Welcome back to the Trinity Chiropractic Patient Resource Library. Today it's shoulder part 2. If you remember last time when we were talking about the shoulder, we put a lot of time and attention into shoulder posture, creating a neutral postural position with the shoulder, and doing some mirror image stretches and stretches for the upper shoulder muscles. Trying to counterbalance a lot of what we do on a day-to-day basis. Things that we might do while we're at work, at a keyboard, driving a vehicle where our shoulders are drawn in quite a bit. Today we want to talk a little bit more about the rotator cuff. It's a mystery word for a lot of people. I often have patients come in and talk about the rotor cuff or the rotatory cuff. The rotator cuff is 4 muscles that attach from your shoulder blade and they go into your arm bone. They're designed for fine-tuning the motions of your shoulder. Many people have problems with these muscles or tendons over time, or they may injure them acutely in some kind of accident or trauma, or from playing a sport where there might be a throwing motion, or swimming, or golf, or tennis. Basically, you can protect these muscles by doing a couple things. Really simple. If you want to take away something from today, take away this. To protect your rotator cuff muscles for your shoulder, be very careful with over shoulder level activities. That's going to expose your shoulder joint to a lot of susceptibility for injury. If you have to, try to lift with your thumb up as opposed to down for any kind of lifting motion. It's easier on the rotator cuff muscles that are vulnerable to injury as well. If you're doing a lot of repetitive work with your arms in an outstretched way, try to get your arm tucked into your torso. If it's touching your torso, there's less stress on your rotator cuff. So to strengthen those muscles a little more specifically, if you've been in the office and we've talked about what type of shoulder problem you have and have been directed to this video, here are a couple of things that you should be doing to accentuate what we're doing in office with your treatment. What we're trying to do here is really strengthen certain muscles in your rotator cuff. The external rotators, the internal rotators have a lot of strength because they're assisted from the large muscles in the front of your shoulder. So the external rotator cuff muscles, the teres minor is one of the major ones that draws the shoulder outward, as well as the infraspinatus. So 3 exercises we're going to go through right now. What you might need for this are either a dumbbell, use your imagination for this. You might be using a TheraBand, the little elasticy bands that we have in the office, or you can use a home or a gym exercise equipment with pulleys. So what you want to do is you want to set up your system such that your tabletop or your bench is parallel to your shoulder. And we're going to do 3 motions of external rotation. Really important with this is controlling the motion at all times, doing enough repetitions that you're not exhausting the muscle. Up to 15 to 20 repetitions is good. You don't want to feel the muscle shake at any point or having to compensate with your motion by changing your body position when you're doing it as well. We're going to be doing 3 positions, so pay very close attention to how we do these for when you're doing them at home or in the gym. If you have any questions, come back to me and we'll talk about them as well. So the first thing that we're going to be doing is I'm going to be using the TheraBand here. We're going to be positioning it with this being a table or an exercise bench, or if you have a surface at home that can replicate the same thing. The first position that we're going to do is we're going to be alongside it, and if this is anchored on the floor, what I'm going to be doing is with my thumb up, I'm going to be rotating 90 degrees straight up with tension. Light enough tension that I can do 15 to 20 repetitions, keeping my arm bent 90 degrees as I'm bringing it up. Second exercise we're going to do is we're going to take our arm and we're going to bring it in front of our body. 90 degrees, and again, lightly bringing it up with some tension. If I was using a dumbbell, I would probably be using about 1 to 2 pounds. Just like that. The third one is while standing up, to anchor your TheraBand or to use a pulley, or if you're using a dumbbell, you'd be lying on your opposite side, for example, on my left side here, and I would be rotating out to the side, 90 degrees, leading with my thumb at the same time. 15 to 20 of those, and I should feel a little bit of tension going through the muscle. It's a very small muscle with a very weak blood supply. You don't want to overtax it. You should not feel any sharp pains while you're doing that, and that should be comfortable through the full rotation that you're doing that exercise. All three of those exercises are crucial to developing a strong rotator cuff, particularly the external rotator muscles in that group. Thank you. We'll see you next time.